In this video, Garrett Hill, a living kidney donor and the founder and CEO of the National Kidney Registry, and Dr. Robert Montgomery, chair of the Department of Surgery and director of New York University's Langone's Transplant Institute, discuss the importance of Eplet mismatching for pediatric patients.
So Bob, talk to us about the importance of this with pediatric patients, young folks.
So, I take care of a lot of kids who end up getting sensitized and come to me because that's been an area of focus of my career. And they're usually on their second or third kidney and they're in their early 20s. And they're in a real bind because they've gotten their first kidney, which maybe failed, during the adolescent years. And maybe, they had trouble maintaining their levels of their immunosuppression and had these dips in their levels, and as a result developed these hazardous antibodies against their donor that then cross-react with other donors, and then maybe received a second transplant that was in a less than ideal situation because their immune system was ready to respond to that organ, had been primed to respond to that organ, and then lost that kidney in a fairly short period of time. And now they're coming around for their third transplant in their early 20s. That's a huge problem. That means that they're going to spend a lot of their life on dialysis, waiting for these long shot matches because they're sensitized. Unfortunately, they're going to have a rough time. So if we can start out with that first transplant when they're children, and get them in a situation where they receive, one of these really favorable matches from a living donor, that's going to give them the longest run, from that kidney. And maybe then we can put them into a trial where we can reduce their immunosuppression, reduce the side effects, which in the teenage years, these side effects from these drugs can really affect their ability to socialize effectively, and oftentimes the adolescent response to that is, I just don't want to take these medications, and then they get into the cycle. But if we can get them on lower doses with less side effects, I think we're in a much better position for them to, take their medications and have that organ, survive and work for decades and decades. So maybe they only need one kidney for the rest of their life.